Dr. Cindy Collins, registered dietitian and health psychologist. So I had a patient ask me if during chemotherapy she could eat sushi or raw oysters. Should anybody be eating sushi or raw oysters? Of course, all right? There's a big controversy about that, right? But if you're from New England or if you're in Florida like I am, and then we ship everything from New England here, you're eating excellent raw oysters and sushi. Now, sushi can be cooked, but I know this question comes from the idea of the fact that a lot of sushi is not cooked. In fact, somebody might argue that really good sushi or real sushi is not a cooked sushi. So what's the difficulty? Why would that be an issue for a cancer patient? When you're on chemotherapy, one of the things that the chemo does in your body is it is acting by influencing your bone marrow, which is where your immune cells, like your white blood cells, for example, are housed and also produced. So if you are not able, for some reason with the chemo, to produce as many of your immune cells, your white blood cells, then you might not have the ability to fight off infections that would be coming your way. So sushi and raw oysters are more likely to have parasites or bacteria on them. It's very difficult in an uncooked meat to really be sure that you're not it's almost impossible to be sure that you don't have a parasite or a bacteria. So that's why with chemotherapy, it's not a good idea. In fact, typically with chemotherapy patients, we suggest that they stay away from raw fruits and vegetables. Salad bars are out of the question. You know, all their food really needs to be cooked. Or think about this, if it's a canned food, it's gone through an ultra high temperature heating process. If it's a boxed food, like in the cardboard boxes that you see, those soups, they've also gone through a high heating process. In those cases, you're safe. You know, some patients want to wait and just see if their white count goes down. And if they're having a lot of labs taken, then it's very easy for your nurse or your doctor to say your white count has been, is down. You have a suppressed immune system. And you know right away, okay, I got to be really careful not to eat any raw fruits and veggies and not to expose myself to any potential pathogens. Other patients know that maybe I'm not going to be disciplined enough to wait, or maybe I don't even want to take the risk to wait until they tell me in my labs that my white count is down. So from day one, starting chemotherapy, they just decide to forego the sushi, the raw oysters, other raw foods, other uncooked foods. I do get the question also, you might already be thinking this, what if I just wash my veggies? Isn't that good enough? And there are a lot of good veggie washes on the market. Even vinegar and water is an excellent way. But I don't think that it's a good idea to take that risk. I think that for that period of time, which is going to be limited, but for that period of time where you're on chemotherapy, it's better to not take the risk and to only eat foods that are cooked or have gone through a heating process.